Regular replacement therapy in children with hemophilia. A short video on administration of therapeutic agents. As per the state policy on hemoglobinopathies and hemophilia care, district daycare centers have been established across the state under the new program umbrella of Asha Dhara. The prophylaxis for children under 10 years of age is being implemented. The factor recommended for regular replacement of children with hemophilia A is factor 8 plus von Willebrand's factor and factor 9 for hemophilia B. For few selected children diagnosed to have hemophilia A with high titer inhibitors and difficult venous access, prophylaxis using the monoclonal antibody emicizumab has been implemented. The prescribing information of Immunate. Immunate contains purified, freeze-dried, virus-inactivated, human plasma-derived coagulation factor 8 plus von Willebrand factor. The indications for its use include treatment of bleeding episodes in von Willebrand's disease, prophylaxis and treatment of hemophilia A, both congenital and acquired. The dosage recommended for long-term prophylaxis as per the state policy is 15 to 25 international units per kilogram body weight of factor 8, 2 days per week. Now, how to store the drug? The product is supplied in a pack containing the factors and solvent vials. The drug should be stored and transported at 2 to 8 degrees Celsius. Store in its original pack and do not freeze. The strength of the vial available contains 250 international units of factor 8 and 190 units of von Willebrand's factor. The route of administration is intravenous. The contents within each pack include a glass vial containing purified plasma-derived freeze-dried form of factor 8 and von Willebrand's factor, 5 ml vial of sterile water for injection, transfer and filter set, disposable syringe of 5 ml and a winged infusion set. Method of administration of Immunate. Instructions for reconstitution. The package should be taken out from the refrigerator 15 to 20 minutes prior to administration in order to warm the vial to room temperature. The label on the carton will provide the details to be noted like date of expiry, batch number, etc. Check the package for any damage as part of the safe injection practices. The leaflet inside will provide the prescribing information of the product. The procedure should be performed under all aseptic precautions. Wash your hands with soap and water before the procedure and wear gloves of appropriate size. Keep the contents of the pack on a sterile surface. The powder vial containing factor 8 and von Willebrand's factor, the 5 ml solvent vial of sterile water for injection, the transfer and filter set, disposable syringe of 5 ml, the winged infusion set. Remove the caps from both the powder and solvent vials. Cleanse the rubber stoppers using alcohol wipe at its middle. Now take the transfer set. Place and press the blue colored undulated rim of the transfer set onto the solvent vial. Then carefully remove the protective covering from the other end of the transfer set, taking care not to touch the exposed end. Invert the transfer set with the attached solvent vial and insert the free needle through the rubber stopper of the powder vial. The solvent will be drawn into the powder vial by vacuum. Approximately after 1 minute, disconnect the two vials by removing the transfer set with the attached solvent vial from the powder vial. The preparation usually dissolves easily. If required, gently agitate the contents. It is very important not to shake or invert the powder vial until ready to withdraw the contents. You have to inspect the solution for any discoloration or particulate matter. Now we can withdraw the dissolved preparation. Fit the filter set onto the enclosed disposable syringe and insert it through the rubber stopper. Now you have to disconnect the syringe for a moment from the filter set. This will allow air to enter into the powder vial and any foam inside will collapse. Draw the solution into the syringe through the filter set. The enclosed filter set will remove the stopper-derived particles if present. Disconnect the syringe from the filter set and using the infusion set available with the pack, slowly inject the drug intravenously. This is a diagram showing different stages for easy reference. The special precautions mentioned are: for reconstitution, use only the infusion set provided with the pack. It should be reconstituted immediately before administration since it contains no preservatives. If you detect any turbidity or discoloration, you should not use the drug and it should be duly reported. After giving injection, do not rub the injection site. Press with a sterile cotton for a minimum of 10 seconds. Apply ice pack if any redness, bruising or swelling. The adverse reactions. The treating physician should be aware of all side effects and adverse reactions including thromboembolism, and reporting of such cases is very important. Formation of inhibitors to factors is a non-complication. It should be followed up and managed as per current guidelines. Allergic type of hypersensitivity reactions are possible with the drug and it should be discontinued if any such reaction. The patient should be informed of early signs of hypersensitivity. Thank you for watching.